There are a lot of myths and concerns concerning diabetes which people carry forward and come to us. Diabetes is actually a metabolic disorder to start with. We don't call diabetes a disease. It's a disorder which affects the carbohydrate, fat and the protein metabolism, usually because of some defect in insulin action or levels in the body. Now, these cause the blood sugar levels to go up in the person, and this high blood sugars can have adverse effects on various organs of your body like your kidneys, your eyes, your heart, your circulation, your nerves, etc. So, essentially diabetes is a chronic progressive metabolic disorder which can affect all organs of your body. Most common symptoms which we are aware of which relate to high blood sugars pertain to increase in the thirst, increase in the appetite and increased urination, especially getting up in the night to go to the loo multiple times. Now, these are the classical symptoms of diabetes, but many patients also come to us with non-healing wounds or genital infections or vague symptoms like giddiness, dizziness, tiredness, fatigue, or just losing weight, loss of appetite, multiple symptoms. One point which is very important for us to remember is all the symptoms which I have mentioned are seen in only 50% of the patients. So, it means that the remaining 50% of them do not have symptoms. So, that becomes an important target to handle, where 50% of patients, they have diabetes but do not manifest any symptoms of diabetes. So, do not wait for symptoms of diabetes to come in. You should be checking your blood sugars in the asymptomatic stage. If you wait for symptoms, you need to understand that the blood sugars are going to be really high. So, it means that when your sugars are high, that time you manifest with symptoms. In the early stage of diabetes, you may not have any symptoms at all. Now, there are 4 types of diabetes which we know today. Type 1 diabetes is the one where there is insulin deficiency happening in the body. This usually comes up a little suddenly, typically seen in children and adolescents, but rarely can also be seen in elderly people. Here, the pancreas stops producing insulin and the blood sugars go high. The more common variety of diabetes which we see today is the type 2 diabetes. Here, the body is producing insulin, but for some reason the insulin is ineffective, which we in scientific terms call as insulin resistance. So, because of insulin resistance, the body is unable to utilize insulin to control the blood sugars. So, this is type 2 diabetes, which is the more common variety, which can be prevented and which can be sort of tackled in the early stages to prevent morbidities and organ damage. The third type of diabetes is what we call as pregnancy related diabetes or gestational diabetes, which is seen in pregnant women, which happens because of the pregnancy related hormones which increase your blood sugar levels. The fourth type of diabetes, which comes under a broad terminology called as secondary diabetes. Now, this is usually because of some medications like chemotherapy medication, some antihypertensives, or it could be because of pancreatic infections, it could be because of pancreatic stones, or it could be because of genetic syndromes like Down syndrome, Turner syndrome. So, all these secondarily affect the pancreas and cause a reduction in the insulin secretion there. So, this comes under a broad category called as secondary diabetes. If you look at type 1 diabetes, the cause here is autoimmunity. It means that your body is producing antibodies against the pancreatic islet cells which produce the hormone insulin. This insulin is important for blood sugar control. So, when your body produces antibodies against insulin, the blood sugars tend to go high. Type 2 diabetes, which is the more common variety, which I said is because of insulin resistance. So, here the insulin is there, but it is ineffective, and that happens because of obesity. One of the most important causes is obesity. Genetic factors are also important here. It means that one of your parents has diabetes, you stand about a 30-40% chance. If both parents are diabetic, that means you stand about a 70 to 80% chance of developing diabetes. Lifestyle factors like a sedentary lifestyle, obesity, smoking, alcohol, they are also implicated in the cause of type 2 diabetes. Pregnancy diabetes, as I said, again it's because of the pregnancy related hormones, and the other variety was because of some factors like drugs, medications, or some infections or stones, which all affect the pancreas and affect the insulin secretion.